Hi, I'm Dr. Aviva Schein from Tenafly Pediatrics, and I'm here today to talk to you about the flu. Now, many people use the term the flu to refer to any number of unpleasant symptoms that their children may have, such as having a stomach flu or having a flu-like illness. But when we pediatricians talk about the flu, we're usually referring specifically to the influenza virus, and that's what I'm going to be discussing today. So influenza is a virus that infects children usually in the winter and spring months. Influenza season tends to run from November to about April in the northern hemisphere. It can cause a variety of symptoms. Most kids who have flu have a high fever, sometimes as high as 103, 104. They tend to have body aches, headache, cough, sore throat, fatigue, and younger kids can also have some stomach complaints like nausea or diarrhea. Unlike a common cold, the flu tends to come on suddenly. It makes kids pretty miserable, and it usually lasts about 3 to 5 days. Now, flu is transmitted through respiratory droplets, so coughing, sneezing, touching is the way that you'll pick up the flu. And generally people are contagious from about 1 day prior to the onset of symptoms up until the 5th to 7th day of their illness. We do have tests for influenza that we can do in our office. It involves a nasal swab. But for most children, we don't usually do a flu test because if it doesn't impact the way we treat our patient, it's not really the most fun test. It involves having a cotton tip stuck up your nose, so we don't like to do the test if it's not going to change our treatment plan. Most kids don't really need any specific treatment for flu beyond some Motrin or Tylenol for their fever and body aches, plenty of fluids, rest, and a little TLC. Unfortunately, there are some children who go on to develop complications of influenza. That can be anything from an ear infection, and it's not that uncommon to have an ear infection that develops on about the 4th to 5th day of influenza infection, to more serious complications such as pneumonia or even complications that require hospitalizations. We know that some children are at increased risk of developing complications from influenza. And those are, first of all, any child under the age of 5, and particularly children under the age of 2, are at higher risk for flu complications, which is part of the reason why in the state of New Jersey, children under 5 who attend daycare or preschool are required to get a flu vaccine every year. Other children who can have complications of influenza include children with underlying medical conditions such as asthma, diabetes, neurologic conditions, or immune problems. Unfortunately, there is a small number of children every year who die of influenza or influenza-related complications, and on average about 100 children per year in the United States will die of influenza. While most of those children do have underlying medical conditions, a recent study showed that approximately 40 or just over 40% of those children were previously healthy children. Now I say this not to scare parents because this is really a rare event, but to emphasize that it's very important to try to prevent children from getting influenza. And of course, usual hygiene measures like hand washing and using hand sanitizers are always important. But for flu, we're lucky that we have a vaccine that can be used to help prevent influenza in children. There are 2 types of flu vaccine that are available. One is a flu shot, which is a killed or inactivated virus, and the other is the flu mist, which is a live virus that is attenuated. Now, the flu shot is approved for children from the ages of 2 months and up, and there are very few contraindications to getting a flu shot every year. The flu mist is available for children over the age of 2 who don't have underlying medical conditions. So children with asthma cannot be given the flu mist. I just want to address a couple of myths about the flu vaccine. People sometimes believe that the flu vaccine can cause the flu. This is just not the case. Obviously, a virus that's killed is not capable of causing disease, so the flu shot cannot cause the flu. The flu mist, while it's made with a live virus, that virus is attenuated so that it cannot reproduce at body temperature. So the flu mist is also not capable of causing influenza disease in a healthy child. There are some side effects to getting flu vaccines. The most common one being soreness at the injection site for kids who are given the flu shot, and for the flu mist, a runny nose or maybe a sore throat that might last a day or 2. A small percentage of kids will also have a low-grade fever after getting a flu vaccine that also might last 1 or 2 days. In terms of treatment, I think I mentioned earlier that most kids with flu don't require any specific kind of treatment other than supportive care. However, there are antiviral medicines available to treat flu. And for certain kids, kids who have underlying medical conditions or kids who are very young, we might suggest using one of those antiviral medicines. Those medications have their own set of side effects, so we don't use them in the majority of kids. But if your doctor thinks it's necessary, they'll talk to you about medications specifically that we use for influenza. That's about it for the flu. If you have any questions, please give the office a call. Thanks for listening.